Programmatic access refers to how a medical practice operates. Its policies, tools, and procedures, availability of properly trained disability-competent staff, and medical responses to individuals with disabilities. Many reported barriers are programmatic in nature, yet this area is less recognized and understood than either physical access or communication access. This video will review best practices and ways to assess your office for the following topics: policies and procedures, availability of person-centered care planning, and training in your office. One of the most important keys to programmatic access for individuals with disabilities is having sufficient, properly trained staff to provide timely, responsive primary care. A disability-competent best practice includes providing frequent, ongoing training opportunities for staff. Training may include a range of topics, including operating accessible equipment, assisting a person who may need help dressing before and after an exam, assisting persons with mobility disability to an exam table or other equipment safely, overcoming stereotypes that may impact how persons with disabilities are treated, involving patients with disabilities in decisions about their medical care, and general etiquette regarding disability and other topics. Truly responsive primary care requires moving beyond the patient's diagnosis. Disability-competent care includes consideration of the patient's goals, values, and healthcare preferences. Every individual needs control and the opportunity to choose what care they want to receive and reject what they do not. When patients have a disability, some healthcare providers lose track of this concept and that of the dignity of risk. In disability-competent care, patients are included in the development of their medical plan, and primary care providers then need to adhere to the plan that is agreed upon. It's important for primary care physicians to be familiar with an organized specialist network who are experienced in serving individuals with disabilities and provide accessible facilities. Individuals with disabilities may encounter an array of secondary complications that can cause functional decline, hospitalizations, poor outcomes, and avoidable costs. Clinical protocols should be set for the identification and treatment of these conditions. Individuals with disabilities may also have conditions that can result in the need for urgent and episodic care. Disability-competent primary care practices commonly provide 24/7 phone service and/or home visits to avoid dependence on costly emergency room visits. Since this care may be provided by a nurse practitioner or primary care provider who is not familiar with the patient, it is critical that there is 24/7 access to healthcare records to help facilitate phone consultation. Responsive primary care includes support in monitoring patient compliance with recommended medication. The primary care provider should review and manage all medications. For patients to be an active part of their own healthcare planning and for them to adhere to the plan, they must be fully informed and educated about self-care. Patients need clear information and guidelines regarding routine health prevention services, management of conditions associated with existing disabilities and chronic illnesses, prevention of secondary conditions of disability, patient and caregiver self-care for chronic conditions, and reproductive health. Disability-competent care calls for patient-centered care, with the patient as a primary source for defining care goals and needs rather than a passive recipient. The disability care team should be trained to support patients to identify and define their preferences, needs, and care goals, and collaborate with them to develop their plan of care. A basic tenet of disability-competent care is the elimination of medical and institutional bias. It can be challenging to change bias, attitudes, stereotypes, and stigmas because they are often unconscious.
Where I think it's harder is if your staff has bias that they bring that you may not even be aware of. And so any provider who's thinking about a quality improvement project for their practice, I would encourage them to have a non-judgmental meeting with their staff and see what their staff actually is thinking. Because if you understand where people are coming from, then it helps go a long way towards making things better for everybody.
There can be big differences for individuals with a disability acquired as an adult and those with a congenital disorder. This can affect their self-image and attitude, the way they are treated due to stereotypes and their care choices, so it's important to consider this key difference. Disability-competent care is interdisciplinary. To care for the whole person, primary care, nursing, behavioral health, and long-term support need to work as a team and communicate closely. To maintain quality, one team member should have final responsibility for adhering to the patient's health plan. The patient should always be able to designate a family member, friend, or caregiver to be part of the interdisciplinary team. But it's also important to make sure you don't default to a family member.
I would like to know that doctors understand my concerns. It is nice if doctors ask if it is okay to talk to my mom and dad.
So many times, people will surprise you with what their healthcare priorities are, and their life goals may vary significantly from what you or others assume. With new patients, a disability-competent best practice is to do an initial assessment that helps begin a relationship and establish trust. Discussing the patient's goals, needs, and expectations is essential to successful patient-centered care management. That discussion should be the basis for a documented plan of care with action steps and interventions, including who is responsible for each with appropriate timeframes. The primary care office may be taking the lead in coordinating the care planning, or they may be assisting with care planning. Primary care is often the medical home for individuals with disabilities who may transition in or out of nursing or rehabilitative care. These transitions often involve navigating systemic barriers for patients, so it's important to have protocols such as universal checklists and staff or referral sources who are trained to manage transitions, including services and insurance issues. The key to patient-centered care management, above all, is truly partnering with individuals with disabilities and their families as patients rather than seeing them as passive clients. The bottom line is they are the experts on their abilities, challenges, and preferences for care. Disability competency means we see patients and their families as a resource rather than a problem. This video series and the accompanying materials are meant to give you information and tips. They're not intended to supersede the requirements found in the Americans with Disabilities Act of 1990. As you begin to assess and make changes in your practice, it is important to consult the ADA for precise requirements.